me. I'm Dr. Tracy Murphy. I'm the Regional Medical Director for South Carolina Department of Health and Environmental Control. Reports are being received continuously and investigations are ongoing. But as of Thursday late afternoon, when the official numbers were updated, there were a total of 456 lab-confirmed cases of coronavirus, COVID-19, in the state in 39 counties. As I mentioned, that number is more today, but we have to update the numbers on a set schedule or else it's always moving. But that's the official numbers you'll find on their website. That'll be updated again later today. Greenville County had 51 at that time, which was the fourth most in the state. Anderson County had 21, and Spartanburg County had 9. At that time of the update yesterday afternoon, there were 9 deaths in South Carolina. Unfortunately and sadly, we have an additional death in a Greenville County resident. It was an elderly person with underlying conditions that would have put them at high risk for complications. That information, again, will be reflected later today on DHEC's official information. Sure. Do you think I need to repeat that, or is that okay?
If you could just do
okay. Sure. So, about the most important thing that I can say is that folks need to stay home when they're sick at the beginning of the illness. And we follow up on reports of COVID. We talk to people. We look at the risk factors, try to determine what's going on out in the community. And unfortunately, we are seeing that people, some people have been working while they're sick, and then it occurs to them that maybe they have COVID, and then they take the appropriate actions. What we really want to emphasize is that people need to stay home at the very first inkling of an illness that could be COVID. We talk about fever and cough and shortness of breath as probably the most significant symptoms, but early on it can present more vaguely with headache, sore throat, myalgias, just general weaknesses. We don't want people to keep working for a couple days and then start thinking that it could be COVID. At the very beginning, people need to stay home if they're at work when they get sick. Need to tell their supervisor from a distance and go home. It's not important at this time that everyone who thinks they may have COVID to be tested. You can take the necessary steps to protect others and take care of yourself at the very beginning of the onset of symptoms. Waiting to see if you think it is, waiting to be tested, exposes other people and puts other people and yourself at risk. What we're really emphasizing now from a public health perspective is tracking the outbreak to look for changing characteristics and such things such as severity, populations that are affected, and the rate of new cases. Certain groups, it is important that they be tested, but given the spread and the transmission in the nation now, particularly in South Carolina, it's not important that everybody seek testing before they decide to take the precautions. There are certain groups that we really do encourage testing, people that have underlying conditions that are high risk for complications, people who are more than mildly ill. We think it's important that healthcare workers maintain the availability of testing. Congregate settings like long-term care facilities, we really need to prioritize those, and we can track the disease and track the changing epidemiology through other means without having to have everybody tested. There will be more cases of this. Unfortunately, there will be more deaths. It's not to be unexpected. When that happens, as we know it will, it doesn't necessarily mean the actions that are being taken are failing or that there's a need to panic. This isn't magical. We know a lot about it. We know the recommendations. People have to take those, but it will still progress. So far this season, we've had over 100 deaths from influenza and 6,400 lab-confirmed cases of influenza. We face influenza, thousands of cases and deaths every year. 2 years ago, we had over 280 influenza deaths. That in no way is meant to minimize COVID. It is meant to keep it in perspective that we deal with diseases like this that take similar control measures periodically. We get through it. It's tough and it can be intense, but we manage, we all pull together, and we do it. We don't exactly know what the total numbers will end up, but that's just what we just have to keep maintaining what we're doing, what's being recommended, and just move forward. And again, panicking doesn't really help your health, your community's health, but maintaining the healthy perspective of what's going on by obtaining information from reliable sources.